Today I'll be talking about the pathogenesis and the clinical spectrum of osteoarthritis. These slides were made by Dr. Ziad Al-Zahrani and adjusted by the Notes Committee. And for a start, we'll be talking about the osteoarthritis. What does the word mean? So osteo means bone, and arthro means joint cartilage, and itis means inflammation. So previously, they used to say that this condition is not about inflammation. It is a degeneration from wear and tear. So lately, that they have realized, and know this condition is a condition of inflammation. So before we talk about the pathophysiology, let's talk about the normal physiology of a normal joint. So here we have two bones in a synovial joint. The synovial joint is made up of a synovium colored in purple and the articular cartilage colored in blue. In the synovium, you'll have two types of cells. You have type A cells. هذه السيلز هي اللي بتسوي clearing الدبرس عندها phagocytic activity إنه أي شيء بيكون بيمشي هنا it captures it and holds it. Okay, and the type B cells they're the ones that they're secreting the synovial fluid. And under you'll have blood vessels and lymphatic vessels underlying those cells. So we talked about what's inside the synovium, and I want you to remember that the type A cells they're clearing the debris, and type B cells the one that are secreting the synovial fluid. For the articular cartilage, we have the articular cartilage and the hyaline cartilage is a connective tissue. Of connective tissue, we have cells. We have here the chondrocyte. It's a cartilage cell. It is maintaining the cartilage, and we have an extracellular matrix of any type of connective tissue. It has an extracellular matrix. An extracellular matrix includes fibers and ground substance. And here on the fibers, we have type 2 collagen providing structural support. Remember that the hyaline cartilage or the chondrocytes, they're having type 2 collagen. They're not having type 1 collagen. It plays a role in that and in the pathogenesis. And proteoglycans, they're like the ground substance is made up of hyaluronic acid, chondroitin sulfate, and keratine sulfate. Together, the articular cartilage is providing elasticity and high tensile strength. And that gives a weight bearing that gives it a feature of weight the joints to weight bear heavy things, and that is distributed to the bone, because it's like a scaffold, the joint, and the whole thing is like a scaffold. If anything is damaged, that's gonna lead to bad things gonna happen, like the normal scaffold will put pressure on the normal ones, and the whole scaffold is going to be disturbed, and then it's going to break down and fall. So what about the osteoarthritis? What's happening in osteoarthritis? So here we're talking about what's going on in this condition. So in the normal activity of any cell, metabolic activity, you have equal anabolic and catabolic activity. Otherwise, things would just break down. So in the osteoarthritis, there is something is causing the chondrocyte to have an increased catabolic activity, which is breaking down the cartilage, and it has a low synthetic activity, meaning it's producing less amount of cartilage, meaning anabolic activity. So المفروض الطبيعي اللي هو في normal cells إنه يكون anabolic ولا catabolic نفس الشيء، بس إيش الشيء ده something that is causing these cells to make up this kind of disrupting the balance between these activities. So before I move on to the risk factors, let's talk about more on the pathophysiology. So the something is going to cause the chondrocytes to make suddenly to switch from making type 1 collagen from making type 2 collagen to type 1 collagen. And type 1 collagen is not supposed to be there, and we know that type 1 collagen موجود في البون على محله. في الchondrocytes المفروض يكون type 2 collagen. وطبعا لما نجيب something different that is not fixed or not it's not providing integrity with the rest of the components, هيكون في disruption. As a result of that, as a result of making type 1 collagen, and proteoglycans also will not interact with type 1 collagen. anabolic activity حتى حيكون ما في proteoglycans. فخلاص إذا chondrocyte is now more having more proteoglycans and making more of the type 1 collagen, that's gonna affect the elasticity of the joint, and that's gonna damage the articular cartilage, and as a result, the chondrocyte will die after a period of time. So what are the things that are causing these cells to die? So mainly شيء طبيعي يعني كل cells عندها a period of time to live and then die, and then they, that's the reason why we have proliferation, and to make more of what's there before it dies. And age here is um, it's the main factor of osteoarthritis لأنه خلاص لو ماتت الchondrocytes they cannot replicate and make more they cannot replicate and then and proliferate if a chondrocyte dies. خلاص لو ماتت it's over. age is a factor. And another things زي mechanical stress. لو مثلا if you're lifting heavy weights, that's gonna add more weight on the joints, and that's gonna be tough on the cartilage. والobesity برضو نفس الشيء. if you're lifting weights or your obesity can affect the the weight bearing ability of the joints. And other causes زي neurological disorders and genetic and medications can also lead to osteoarthritis. Or as like any other thing, having a joint injury, a fracture or dislocation can increase the risk of having osteoarthritis. For example, you have a joint injury will result into an inflammation, and that will result with the release of the typical inflammatory cytokines زي ال IL-1, IL-6 and tumor necrosis factor. طبعا الانفلاميشن حيزيد من الكاتابوليك activity، حيوقف الانابوليك activity حقت الchondrocytes. So maybe we'll talk about the difference between other disease. Before we talk about the difference between any other thing, let's talk about the main things and what's about this disease. عشان لو if you found these radiographic findings, if you found this in a case or any patient is presented with these findings, خلاص you can identify or you can either diagnose the patient with osteoarthritis if it's confirmed, or you can have it on your differential. So hibernation means the first feature is hibernation, where the bone will look like an ivory, polished ivory. Ivory اللي هو يكون white creamy color بيكون موجود على البون. يعني زي هنا في صورة femoral head in patients with more advanced osteoarthritis. They have found إنه they noticed إنه في hibernation effect كده على ال articular cartilage, which is not supposed to be there. كأنه polished ivory. وفي another finding إنه في finding تاني إنه البون يصير له subchondral bone اللي هو تحت articular cartilage بيصير له sclerosis، بيصير له hardening. وإحنا I mentioned إنه التايب 1 كولاجين موجود في البونز. فلما الchondrocytes تموت خلاص there is already type 1 collagen. It's much more easier to have subchondral sclerosis. خلاص حيكون كده باين التصلب الزايد هذا في البونز، في أطراف البونز ملحوظ يعني في ال osteoarthritic patients. و another feature الأوستيوفايتس. يعني الأوستيوفايتس برضو is another finding radiographic finding ممكن تلاقيه غالبا هتلاقيه في osteoarthritic patient آه زي مثلا burden node burden node إنه يكون في like nodules موجودة على distal interphalangeal joints. That's what the burden node refers to. Well, a Bouchard node refers to the proximal. I just want you to be familiar with these things because we'll be talking and mentioning them over and over. And الأوستيوفايت اللي هي زي البروتوبرنس تطلع عشان مع ال repeated stress ما في بيكون كولج بيكون في كاشينج. ف الأوستيوفايت هذا بيضغط على السينوفيوم وبيسوي inflammation. we'll talk more about that. We'll be talking about that more. For treatment, we'll talk about treatment background. If you just this is briefly put it in if you would like to have a background about how to treat, and there is a lecture about treatment options of osteoarthritis. Let's talk about the definition of osteoarthritis. Osteoarthritis is currently defined as the American College of Rheumatology as a heterogeneous group of conditions that lead to joint symptoms and signs which are associated with defective integrity of articular cartilage in addition to related changes in the underlying bone at the joint margin. ايش يعني ده ال definition؟ definition هنا بيقول لك انه في conditions. conditions اللي قلت لك I've mentioned في Pathophysiology انه في أشياء is making the chondrocyte الكاتابوليك activity بتزيد عن الانابolic activity، وهذا بيخرب على defective integrity حق الارتيكولار cartilage. ايش defective integrity؟ المفروض يكون في type 2 collagen، المفروض يكون في everything السكافولد كله متناسب مع بعضه، ما حتضيف لي structure غريب على typical structure، وأكيد خلاص كل شيء ما they'll not adapt normally لأنه جبت شيء غريب، والشيء الغريب اللي هو something that triggered the chondrocyte إنه خلاص تسوي الشيء الغريب ده. In addition to related changes in the underlying bone at the joint margins اللي هي that I've mentioned اللي هي الابرنيشن again. الابرنيشن اللي هي هذه زي ال polished ivory، وفي الأوستيوفايتس subchondral bone sclerosis. Subchondral sclerosis برضو this is what the definition is referring to. So breaking down the definition is another way to like understand the concept. If you find any other definition, you can know what it's talking about or what osteoarthritis is about. For osteoarthritis diseases are a result of both mechanical and biological events that destabilize the normal coupling of degradation, synthesis of articular cartilage chondrocyte, extracellular matrix, and subchondral bone. زي ما شرحت إنه يكون في disruption في metabolic activity، المفروض الميتابوليك والكتابوليك يكونوا متساويين balance. بس هنا هنا بيكون زي ما هو كاتب ال definition. Literally the definition summarizes what I've said and what I've explained in pathophysiology. Backing on talking about the pathophysiology إنه الchondrocyte هنا طبعا لما الكوندروسايت يموت إيش حيصير هنا؟ حيصير فيه fibrillation، حيصير فيه زي الكليفتنج، يعني كده حيكون في الارتيكولار كارلج نفسه حيكون في زي الكليفتس فيه. الكليفتس هذه معناه إنه الكارلج جالس يتكسر، فالكوندروسايتس تبدأ تصير floating في السينوفيوم، يسموها joint mice. الjoint mice هذا will be captured by إيش؟ اللي if you guys can remember في السينوفيوم قلنا في two types of cells type A و type B. type A هي vacuum cleaner، هي that will clean what's the debris اللي موجود في السينوفيوم، و type B will secrete the synovial fluid. they'll catch the mice. طبعا لما they catch it they'll حيجوا lymphocytes أو lymphocytes will secrete اللي هو IL-1 IL-6 the human process factor. That's gonna trigger an inflammation. Inflammation ما يخف. It's not relieved. it is continuous لأنه خلاص مع الactivity it'll be breaking down لين ما يروح والinflammation حيكون continuous. Osteoarthritis basically it's about reduced synthesis and increased degradation. طيب هنا we'll be talking about the incidence of osteoarthritis. Mainly related to age. الانسيدنس we've mentioned that. قلنا في بعض الستاديز وبعض الريفرنسز بتقول لك إنه يكون above 40 بعضها تقول لك above 50 and some of them says above 60 أو يعني there is not no certain age بس أهم شيء إنه as people age they're more prone to osteoarthritis. هذا the most important thing. And the women from perimenopausal ages and older are more likely to develop osteoarthritis of the knee, hip, hand than are men. معناته إنه في الجندر women they are more prone to osteoarthritis and it is more prevalent in women. Well, most common regions synovial joints of having osteoarthritis اللي هو الني والهip والهاند. هذه أكتر the most prevalent regions where osteoarthritis is found in these synovial joints. فهنا this is a table for it was you don't have to memorize these numbers. You just have to interpret the main idea of these tables and these studies, different studies. So when we say symptomatic osteoarthritis in the affected joints, symptomatic osteoarthritis means the patient has pain and has radiographic findings. So they have conducted that in 100,000 patients, and they have noticed 164 to 240 patients. They've been having osteoarthritis in their knee. And from this table, from these findings, you can say خلاص patients you can find symptomatic osteoarthritis in the knee joint. Find it in the hip and the hand. الفرق بين الهيب والهاند إنه في بعض الستديز يقول لك إنه الهيب أكتر أو الهاند أكتر. it's not يعني they're switching places. بعضها ياخد second base يا الهيب يا الهاند but it's always the knee. It's always there. يعني osteoarthritis is always present in the knee most of the times, not always but most of the times. So you might so these patients طبعا these patients بعضهم ما يكون عندهم pain present ف they either discover that by chance إنه خلاص سووا مثلا radiographic X-ray بس ال patient is not complaining about anything بس حيلاقوا إنه في osteophyte حيلاقوا إنه مثلا ال space حق ال articular cartilage has been impaired أو حيكون حيكون impaired حيلاقوا some of these findings or features of osteoarthritis. فهنا بعض ال studies regarding the prevalence of osteoarthritis. Osteoarthritis is extremely common joint disorder in all population. Prevalence estimate across studies vary because of inconsistent definition of symptoms and radiographic changes. اللي اختلف between الدراسات إنه ما في بعضهم مثلا it's kind of like subjective من ناحية إنه لما ال doctors or الدكتورز لما يطلوا في ال radiographic findings ممكن يشوفوها ممكن ما يشوفوها لأنه ما هي مرة واضحة والsymptoms تختلف يعني it varies ال symptoms presentation. فمو مرة إنه يعني ال prevalence is not that accurate. Like it's something normal. So radiographic disease is highly prevalent with a radiographic hand. Okay, this is talking about a study. So another study about radiographic disease is highly prevalent with radiographic hand osteoarthritis occurring in approximately 32.5% of all adults aged 30 and over. And this is a study conducted by Framingham. Study suggested that the radiographic knee occurs in 33% of people aged 63 years and over. So you just have to know radiographic osteoarthritis is more common than the symptomatic. That's what you basically have to know. Talking about more studies from the US, USA, and Europe suggested that radiographic hip osteoarthritis occurs in roughly 3 to 4% of elders. It's not that common, بس يعني الهip it's not that common. هو الهاند يعني it's not that common in studies. Symptomatic osteoarthritis generally defined as a frequent joint pain plus radiographic change. هذا هو symptomatic osteoarthritis. هذا line should have been, written way earlier to describe what's a symptomatic osteoarthritis, but whatever. Uh, let's keep going with the studies. Its prevalence in the knee has ranged in different studies from 1.6 to 9.4% of adults and 10 to 15% of elders. The symptomatic hip osteoarthritis occurs anywhere from 0.7 to 4.4% of adults. Using British data from 1960s, symptomatic hand osteoarthritis occurs in 2.6 of adults. You just basically have to know that radiographic osteoarthritis is more common than the symptomatic again. And I don't have to memorize the numbers. You just have to interpret the numbers and see the pattern. Notice the pattern in هنا different studies for Framingham and Johnston country about the sites of hand, knees and hips because they're the most common. So ممكن تلاحظوا إنه radiographic osteoarthritis is more common but symptomatic is less. وتلاحظوا إنه it's been increasing with age. هنا the same idea إنه الفرق بين الميل والفيميل في بعض الستيز وبعض المناطق differs, like these are more younger, فيكون الفرق مرة واضح بينهم. يعني زي مثلا في الهانز يكون الفرق مرة واضح. النيز فرق قليل بس في الفيميل أكتر زي ما قلنا هو more prevalent in females. As much as you increase in age, as people age, طبعا بيكون ال percentage أعلى. طيب pathogenesis again, remember hibernation looks like polished ivory and osteophytes, Eberden nodes and Bouchard nodes. These are the their presentation like hibernation and the subchondrosclerosis, where you have newly formed bone under the cartilage and looks like extremely white and kind of glowing. So I'll be explaining what do I mean by glowing and in the radiographic findings. But let's let's talk about the tissues affected in osteoarthritis. So I have tissue like cartilage. The finding will be cartilage loss, as we've said, and the bone will be having osteophytes that are mentioned again, subchondral bone sclerosis, and hibernation is having a polished ivory, and that's all. That's about the bone. And the synovium will have focal inflammation. This is in comparison with rheumatoid arthritis, and I'll explain it later. What's the difference between osteoarthritis after we have clarified the symptoms and the presentations, because explaining that earlier would be been more complicated. So that's it. Yeah. The pathological features again, you'll have a focal inflammation. In the osteoarthritis focal, like in one side, you have destructed cartilage, and you have capsular fibrosis and osteophyte formation. Osteophyte does like an effusion and pressure, increasing the synovial fluid on the synovial capsule, so that's gonna cause swelling and maybe could cause pain. طبعا مع ال destruction of cartilage بيكون في subchondral sclerosis عشان what happens here in osteoblast or osteoblast or osteoclast activity will be activated, and they'll be thinking that there's something, cells recover in the bone, so they'll be making um, uh, uh, new bone, uh, new bone like regions with where the uh, ca- uh, where the where the cartilage has been destroyed. So the osteophyte formation, I've mentioned that due to the excessive stress and inflammation and damage. The synovial hyperplasia due to the effusion and the increased pressure on them. And the subchondral bone remodeling sclerosis. This is where an excessive stress has been happening. And um, yeah, these are the pathological features of osteoarthritis. In osteoarthritis, again, we have focal, as you guys notice, we have focal. We don't have it in both sides. We have a focal inflammation affecting one side, not both sides. Uh, it says medial side is the most common affected side. However, in rheumatoid and other things, you might have uh, diffuse inflammation where you have multiple joints and affected and inflamed. Another slide explaining the pathological feature of osteoarthritis. Here we have a remodeling bone. We having remodeling bone. There was a chondrosclerosis. We have fibrillation, as we expected. There were lifting حق articular cartilage. هيكون في focal loss more on both sides. Marginal osteophyte اللي هو هذا bruising out due to damage, inflammation, and excessive stress and repeated stress. Subchondrosclerosis. With secondary bursitis, within the inflammation, you might have your bursa and you'll have a secondary enthesopathy. Enthesopathy means inflammation of the tendons, and you'll notice some synovial hyperplasia due to inflammation too. Osteochondral osteochondral bone is a broken down osteophyte, and you'll notice some capsular thickening. Another slide explaining the difference between an osteoarthritis and other inflammatory arthritis. So in osteoarthritis, the condition is chronic. It's not like an acute. It doesn't have an acute onset. You'll notice some subchondral sclerosis. You'll notice subchondral cysts in the subchondral sclerosis. Osteophytes bruising out and focal cartilage loss. While in the inflammatory arthritis, you have diffuse cartilage loss. You might have erosions زي مثلا لو كان عنده osteomyelitis and it's been uh, going more on in the bones, and you'll notice some enthesitis and tendinovitis, subchondral osteopenia, joint effusions. Effusions are more noticed in septic arthritis and osteomyelitis and other type of inflammatory arthritis. بس هنا it's not في osteoarthritis it's not commonly that found. Muscle atrophy هيكون بسبب effusions. For example, if you have an effusion بسبب increased pressure جوة السينوفيوم هيضغط على المسلز، فلما يضغط على المسلز ويسوي compression للvessels وال ال arteries that supply the muscles and the components here. You'll cut down their supply and nutrient and their nutrition. So they'll undergo hypoxia, and then they'll develop undergo necrosis. And if, for example, if you have some sort of septic infection or a microbe involved, you'll have increased white blood cells. You'll have glucose level actually too. If you suspect that there's an infection, you might withdraw some synovial fluid, and you'll notice some microbes presented in after the analysis. So the risk factors for osteoarthritis, I've covered them previously, but I'll talk about them again. For systematic factors affecting joint vulnerability, you have the age. كل ما يزيد الناس في العمر كل ما uh, they're more prone to osteoarthritis. Their gender, females are more prone, race, and genetic susceptibility, nutritional factors. Vitamin D deficiency might affect the bones, making them not because vitamin D is essential for bone and mineral uh, uh, vitamin D is essential, for bones formation and calcium and intrinsic vulnerabilities, local inflammation, previous damage, and for example, if the patient had trauma like ACL tear, cartilage not responsive, malalignment, and paraseptic deficiencies, إنه البيشنت ما حيكون aware of his body positions, he will have micro traumas, and that can uh, lead to susceptibility to osteoarthritis. And the main two things that are causing osteoarthritis or increasing its progression is obesity. The main two things are obesity and injurious physical activity. And when people are lifting weights or things, that's gonna put more loading on these joints. So there is no way to escape this. Either you're being fit, you're having osteoarthritis, or you're not just careless and you're you're so we are all prone to osteoarthritis. And some of the risk factors for the development of osteoarthritis, we have constitution, susceptibility, hereditary genes, gender and hormonal status, obesity, high bone mineral density, and age is shared in between as a constitution, susceptibility, and the mechanical factor. Trauma, joint shape, malalignment, how much you use, occupational recreation. For example, for occupational, we've noticed in our PBL, one of the PBL cases where there was uh, a patient is working on a farm, so we had we had him diagnosed with osteoarthritis because he's been using his joints excessively. Joints are affected by osteoarthritis. And there are multiple areas where you can notice some osteoarthritis غير الني والهاند والهيب في especially ممكن نحدد areas زيادة اللي هي first carpal metacarpal والdistal and proximal interphalangeal والcervical vertebra والlower lumbar vertebrae. We all know these areas are essential for weight bearing لأنه عندهم intervertebral disc the largest and the thickest عشان for weight bearing purposes والhip والknee والfirst metacarpophalangeal. Be careful, it's the first metacarpophalangeal. Here it's the first carpometacarpal. And joints affected by osteoarthritis. This is another slide explaining the joints that are affected by osteoarthritis. You got the sternoclavicular joint, acromioclavicular, and these joints are not involved. While you have other joints, the knee, the hip, the knee, the first metacarpophalangeal, and the lower lumbar, the cervical. So classification of osteoarthritis. They'll be classified osteoarthritis as primary and secondary. Primary if there is no underlying cause for osteoarthritis. If a patient has been presented with a hand with osteoarthritis, for example, in the distal, we said the distal is bouchard, and no, the distal is Herberden. I'm sorry about that, and proximal interphalangeal joint is the bouchard, and the carpometacarpal joint also. And you got the feet, the first metacarpophalangeal, And the knee, you can have the medial and the lateral, all the patellofemoral, and the hip. Uh, Also, it can be noticed the spine and other sites like I've mentioned them before, like the sternoclavicular, acromioclavicular, and many others. It is considered generalized if you have three or more of these joints have been areas have been affected. Secondary reasons, you have trauma, congenital, developmental, metabolic, endocrine disease, calcium deposition, other bone and joint disease, neuropathic, arthropathy, and like just one of the things like maybe you can talk you should have more um you can actually like go through this table. It's actually interesting. It carries many of the reasons and explanations where you might have osteoarthritis. So for example, it might help you if you had a young patient and he's having osteoarthritis. You can write have this list in your differential and minimize your differential. So it's really interesting to go through these classifications of the secondary osteoarthritis. Talking about the common symptoms, patient هيكون عنده ألم, stiffness, alteration in shape, valgus and varus. We'll talk about that in a second. And functional impairment, anxiety and depression. Again, referring to why it can be there, it cannot be there. Sometimes there, sometimes not. For example, if the patient has been having working on a farm, he's gonna lose his job because he cannot work anymore because he is having osteoarthritis in his hand. Um, Referring to like the PBL case too. Again, if you want to remember the the symptoms. Crepitus also means a creaking sound. Can be noticed, restricted movement, tenderness, bony swelling, deformity, muscle wasting and weakness because you'll stop moving that joint a lot, and you'll give it rest a lot. And effusions, there's some microbes involved. Instability, sometimes there, sometimes not, and altered gait. And for effusions, if you notice some increased warmth, you might have septic arthritis in your case, in your differential, and if you have septic arthritis, you need to take immediate action and deal with it in the ER. While the osteoarthritis is just has a insidious onset, which is over months and years. It doesn't come acute suddenly by a few days. The age, as I said, 45, 40, 50, 60. Uh, it doesn't matter. Like there as much as people age, they're more prone to osteoarthritis again. And for a variable or intermittent over time, the pain. Talking about the pain here, is mainly related to movement. So the pain is increasing with motion. In weight-bearing activities, it is relieved by rest. And something I want to talk about here, and I want you to remember that the morning stiffness is noticed uh, with less than 15 minutes in the morning. It's not uh, it's not it's not more than 15 minutes. And you'll notice some brief gilling after rest. Gilling is like referring to where the stiffness is relapsing again after you're relaxing for a long period of time. Usually one or few joints are affected. It's like focal. It's a focal inflammation. Only a few joints are affected, not all the joints at once. It's not something systematic. Uh, it's not something systemic. It's not diffusing. It's not diffusing throughout the body. So it's not. It's so and brief killing after rest, and then usually only one or few joints are painful. It's not something systemic. It's not multiple regional pain. It's only like one or two joints are been affected. And restrictive motion due to osteophytes and the effusion and the swelling might be there, palpable and audible crepitus. Bony swelling like osteophyte. Deformity can be noticed and sometimes not there. Um, Joint lines or prearticular tenderness, muscle weakness, may not, so it's not necessarily there. So this is just another picture talking about what is present in the body reactive changes. This is what I want to talk about. Hypertons and Bouchard's nose. Uh, Hypertons are distal and Bouchard's are proximal. And another picture talking about hand osteoarthritis. You can see them here, here, and here, and here, and here. You know, the distal ones, again, the Hyperton and the proximal Bouchard. And some of the mucus cysts exuding hyaluronic rich jelly extending from the distal pharyngeal joint. Mucus cysts, they've been seen more commonly in patients with osteoarthritis, but they don't know what's the reason why they're rupturing up like that. They think that due to the stress and the uh, concurrent inflammation of the joint, patients are presented with a mucus cyst and hand osteoarthritis. And for a carpal intercarpal joint, this is a picture explaining how it looks. And another typical radiographic features in the osteoarthritis, a gauze vein, يكون عندك في الرياض هيكون ما في spaces هتلاقي الجوينتس كده interlocking يمكن بتدي زي طار النورس زي ما مكتوب هنا تكون طالعة عشان ما في spaces ما في cartilage. فهنا الفيت osteoarthritis هنا في الهالكس هالكس means big toe and the valgus means إنه بيكون في outward angulation فأقول distal fragment إنه هنا الangulation يكون على برا فبيكون let me just get a picture, a proper picture to explain this. For hip osteoarthritis, we have the superior, it could be superior, it could be axial, it could be medial. Superior we call it eccentric, axial, medial we call it concentric. That's how they classify them. And this is a pattern hip osteoarthritis. Yeah, talking about knee malalignment, what I meant by virus in August. Here we notice that there's an inward angle in the virus. We have an inward angulation of the distal fragment, segment I mean. So if you have a distal, like an inward angulation, هيكون طالع على برا. لما يكون طالع على برا الجوينت كده نسميها virus. لما يكون داخل على جوا يكون inward. وعندك outward angulation of the distal segment يكون داخل على جوا بيسموه valgus. Okay. هنا apparent deformity in the knee, referring to what I've just explained. And we have a Baker's cyst. Baker's cyst is a swelling in the popliteal fossa. It's been noticed in patients with osteoarthritis. This is the Baker's cyst. Radiographic grading of osteoarthritis. Radiographic grading system for osteoarthritis. So if you notice, if you're doubtful, if you look into the radiograph and notice that you're not sure if the patient has a small osteophyte, not sure if you don't find something significant, then you can grade it as 1. If you found, if you're real, if you're like sure that you found an osteophyte, but you notice that the spaces between the joints are unimpaired, then you grade it as 2. وإذا كان الجوينت سبيس شوية impaired في يعني البون داخل على بعضه شوية ما يكون في مساحة بينهم will grade as 3. بس لو لقيت joint space أو لقيت sclerosis or subchondral sclerosis of the subchondral bone والosteophyte والjoint spaces have been impaired all over as a group of findings in one patient, you can grade it as grade 4. Okay. Radiological features of the knee. This is why I refer by the impaired joint space. It should be wide. اسمه يكون مرة واضح جواه عارف إنه technical it's there. It's not there anymore. So this is just a progression over time of grade 1, grade 2, and grade 3. In grade 4, you can see grade 4 هنا في third phase. ممكن تلاقي الأوستيوفايت. ممكن أوريكم صور على على الأوستيوفايت والإمبيرت سبيس هنا. لو تلاحظوا في في metacarpophalangeal joint of في الجريد سو. هنا بيكون في امبيرت سبيس وبيكون في اللي هو شايفين كيف البيشنت عنده البون اللي فيها الأوستيوارثرايتس كيف كده منورة وglowing. This is what I mean by the subchondral bone sclerosis. إنه في remodeling activity has been made recently. هتلاقي البون كده كأنه has been made fresh, which is weird. المفروض ما يكون موجود زي كده. عليك إنه هنا في osteoarthritis in these joints. Another picture I would like to show you uh, this patient. If you notice, uh, شوف الأدوات الثانية كيف السبيس واسع بس هنا السبيس ضيقة. وفي ملاحظين إن السبكوندال bone is too bright. It's glowing, so you know it's an osteoarthritis. And uh, these are some of the pictures about the butchers and hair burden. Going back to the slide, the patellofemoral compartment disease, it's a known disease. It's known as a syndrome called runner's knee. موجود commonly اللي يلعبوا athletes اللي that participating in um, like the marathon. ممكن تلاقي يكون عندهم من كتر التمرين والجري وزي كده يكون عندهم الديزيز ده فهذا is highly associated مع osteoarthritis. And here it's explaining some of the differences in a pyrophosphate arthropathy. It's talking about differences في locations of inflammation. هنا ال take care of that ممكن تجي منطقة first هنا. So you just have to differentiate. These are two different diseases, or if you found them, the patient has secondary osteoarthritis. لأن secondary osteoarthritis لأن عنده هذه الأشياء هذه metabolic diseases, calcium disposition disease. So you have to take this into consideration. So whenever you diagnose a patient, you'll have to take a complete history عشان تعرف إنه هو secondary ولا primary. ما يحتاج blood tests unless if you had to do that لأنه ممكن يكون ال patient عنده septic arthritis. If you notice some like an acute onset of the case of pain of everything, physicians may want to check the inflammatory markers زي erythrocyte limitation rate CRG14. هذول markers معروفة لأنه تبين البيشنت يكون عنده inflammation, concomitant inflammation. Checking rheumatoid factors and antitrypsin peptide only if there is suspicion of rheumatoid arthritis. Talking about rheumatoid arthritis, so if you want to differentiate between osteoarthritis and rheumatoid arthritis, when you do a blood sample, you should look out for the anti-citrulline peptide antibodies. If it's positive, you could suspect osteoarthritis. And also, let me just go back real quick to that picture, explain the difference between them. So what's the difference between them? You might have that question in mind. So another difference in for stiffness, early morning stiffness less than 1 hour, like for 15 minutes, and by the end of the day, because you've been using your joints excessively, فيكون osteoarthritis بيكون يزيد مع activity والrheumatoid arthritis لا. And stiffness بيكون more than 1 hour, early morning stiffness more than 1 hour. يكون في pain في السنين هنا swelling بيكون مو دائما موجود والpain بيكون sharp و burning reversed with a feeling. So that's it. Yeah.
So, moving on, synovial fluid examination is not required unless there is an alternative diagnosis like septic arthritis. Whenever performed, synovial fluid analysis usually reveals white blood cell count less than 2000. يكون طبيعي ما يكون فيه infection. Radiographs are helpful to confirm diagnosis of osteoarthritis and include other causes like if you have noticed some erosions or you might suspect anything else. For characteristic radiograph findings include osteophyte joint space narrowing, subchondral sclerosis, and cysts. Ultrasound can be used also, another type of screening method, instead of using X-ray. في الالتراساوند uh, في الالتراساوند ممكن مثلا if you want to draw some synovial fluid, basically you can see things more clearly. But if you wanna um, like do an anthrocentesis or draw some have an intra-articular injection, you might use a guided ultrasound, uh, guided ultrasound anthrocentesis, which is makes it possible to look through the needle, because عشان انت ما تبغى مثلا impinge the sciatic nerve, so avoid that. وال MRI, it's of course طبعا حيكون offers an outstanding soft tissue visualization. ممكن تستخدمه if you're not really sure from the X-ray, or ممكن تستخدمه if you're suspecting to detect a pathological change at an early stage of the disease that